listening to On the Way Home with your host, Michael Braithwaite.
Hey, friends of On the Way Home, welcome to another episode. Man, I think we've been doing this for close to 5 years now. We started with Out of the Blue a few years back, switched to On the Way Home. What a journey it's been. So many brilliant people, so many wonderful people, passionate people, brilliant people. We've looked at research, reports. We've talked to people with lived experience that are lived experts. And we've talked to people all over the world and across Canada about the challenges they're facing, but as well, more importantly, the solutions that they're bringing forward. And today's guest, Tyler Campbell from the Greater City of Sudbury, is no exception to that. Before we get rolling talking with Tyler, I want to tell you a little bit about Blue Door. So Blue Door is my organization, and they produce this podcast. We're an organization that is over 42 years old, that we've been working primarily in the north of the city of Toronto. So we work in York, Peel, and Durham regions. We do a lot of work around housing our most vulnerable, different housing options from emergency to transitional to supportive to specialized housing around 2S LGBTQ plus youth and senior men. We have a fantastic program that has put over 500 people into the trades where they get well-paying and meaningful jobs that lift them out of poverty. It's called Construct, and we run that in Durham, Peel, and York, and are looking to expand that across Ontario and across Canada, not for Blue Door necessarily to run it, for others to take on the program as it's designed and have a greater impact lifting people out of poverty. And so we'll have more on that soon. We'll have some guests to come in and talk about that expansion. And as well, of course, we're doing some initiatives in healthcare, right, where we're bringing health to the clients instead of expecting them to go find health resources. Health and homelessness always overlap. And so Blue Door's doing that work. And we have recently launched a subsidiary of Blue Door, Housing for All Land Trust, that will have its soft launch later in December, but really a program that looks to acquire housing and land in perpetuity, deeply affordable, so we can provide options to people who desperately need affordable and supportive housing. That much more. I work with a team of about close to 150 people that do the heavy lifting. They're incredible people. Right now we're doing this cool project where we're taking down a small house on a big piece of land, and we're putting up 14 stacked townhomes, and soon we will have the groundbreaking for that. In 18 months from now, hopefully we'll have 14 stacked, deeply affordable units for the region of York and in the city or in the town of Newmarket. And just a shout out to the mayor of Newmarket and that council who've been so supportive throughout this process. Our good friends at the region, the federal government, the provincial government, all have been very supportive in making this happen. So let's get to today's guest. When we talk about Sudbury, I think some people will know, well, that's in Northern Ontario. If you don't know, that's where it is. And Tyler talks a little bit about that. But the City of Greater Sudbury is facing huge challenges because it has a population of 180,000. And it's not just serving the City of Greater Sudbury. It acts as the hub for the north. So it is the largest city in Northern Ontario. And so a lot of people, when they need healthcare services, housing, etc., they'll flow down into Sudbury. So Sudbury's has some big challenges, as every city has. They've had encampment challenges, housing costs have gone up. They have a massive, well, the biggest mining industry in the world. So unemployment is very low. But housing prices have really shot up, and there's a lack of it. And Tyler talks about the vacancy rate in Sudbury being in a negative, where there's just nowhere for people to go. So they've risen to that challenge through the mayor and council in the Greater City of Sudbury. They have a plan to end homelessness by 2030. Tyler walks us through the pillars around that, which is fascinating. Some of the plans they have, what they're going to do, what they have done. He talks about an innovative new partnership with a health provider that will open in January 2025, and all the different pieces they've looked at and brought together. It really is a city that I believe can end homelessness by 2030. They're certainly on their way. It's a fascinating discussion and so many gems, what Tyler talks about, that we can take and scale elsewhere across Canada, across Ontario, around the world. So you don't want to miss this podcast. Take a listen. I hope you enjoyed it as much as I did. Tyler, thanks so much for making the time today to join us on the podcast.
Thanks, Michael. Great to be here.
So we ask the same question to everyone because it's a very personal question and there's no right or wrong answers. I always say there's better ones, but no right or wrong. And that is, what does home mean to you?
Yeah, so certainly when I hear about the word home, it really speaks to stability, right? And certainly from where I sit in the job that I do, it's about a connection to social determinants of health, and but really about that stability piece. So we talk a lot within our team, when we're trying to save an eviction, for example. We think about the impact that saving that eviction has on an individual and specifically a family. Like when you think about it, I have two young kids at home, and I couldn't imagine being uprooted from my house and having to move around to different areas in the city, for example, on a yearly basis to try to find adequate housing. So adequate housing really is about stability and social determinants of health for me.
I love that. Thank you. And you mentioned your job. Like your job is you've got a massive job. So you're director of children and social services, but oversee all sorts of stuff, and you're doing all sorts of stuff. But I want to take it a little further back. We want to learn a little bit more about you as a guest. Can you talk about your journey into this sector?
Sure, that's great, Michael. So I've been with the City of Greater Sudbury since 2011. So can't believe it's been, 13 years now at the city. Started out in children's services, so always in sort of the human services sphere here in Greater Sudbury. And as time has progressed, I've sort of moved into the role which I'm currently in right now, which is the Director of Children and Social Services. And you're quite correct, three huge portfolios under that, and basically it's children's services, which looks at our licensed childcare programs in this Greater Sudbury district, and of course the rollout of the national childcare program here in Greater Sudbury. The other component is the Ontario Works program here in Greater Sudbury. And then also the third component, which has grown unfortunately exponentially over the last couple of years, is homelessness. When I started in this role as director, I think 7 years ago now, I had basically one resource, one person that was sort of doing work in the homelessness sector here, sort of managing our contracts for the shelter system. That was about the end of it, the extent of it. We had capacity within our shelter system. And, I was helping that individual off sort of the corner of my desk. And now it's become a complete section on into itself. And, with staff resourcing to that. And, now we're seeing, a completely different situation than we were in, 7 years ago, especially in Greater Sudbury.
And let's talk more about that for people maybe unfamiliar that are not in Canada or in other parts of Canada. Talk about the greater city of Sudbury. Where is it kind of located, and what does homelessness and poverty look like? And you talked about why, and let's talk about why it maybe has things have gone the wrong way in a sense over the last 7 years when it comes to people experiencing homelessness.
Yeah, absolutely, Michael. So, Greater Sudbury is located in Northern Ontario, so just north of Toronto, about 3.5 hours drive, depending on how fast you want to go. And we've got a population of just under 180,000 people over a vast geography. So, to put it in perspective, we've got a land geography of about 3,200 square feet or square kilometers, sorry. And you put that in perspective, that takes in all of the greater Toronto area, York, Peel region, Mississauga, and you'd still have kilometers left over. So huge natural resources here. We've got access to hundreds of lakes, hundreds of hectares of parkland in Greater Sudbury, and great access to nature and natural resources. And from that perspective, we're also the mining capital of the world, right? So we've got huge tier one nickel deposits here in Greater Sudbury. We've got a mining supply and service cluster of approximately 300 firms strong, and they're exporting knowledge throughout the world, right? They're exporting knowledge into, especially into the battery electric boom that's occurring in terms of the critical minerals that are needed worldwide. And from that perspective, we have a huge contribution to GDP in Ontario. So we're the 10th largest contributor to GDP in Ontario. And we've got a great unemployment rate. Like our unemployment rate's sitting around 5.7, and it's lower than the provincial and national average. The other thing that some listeners may know, also, they may recognize Greater Sudbury from films such as or TV shows such as Letterkenny and Shoresy. So if you've seen those, you've had a taste of Greater Sudbury from that perspective. But getting back to the economic development, Michael, and you're probably familiar with this. There's an economic theory out there, right? That says as long as you've got robust economy, you've got full employment, you've got access to good paying jobs, it'll lift all boats, right? It'll lift all boats out of poverty. And certainly we're not seeing that, right? And I don't think we're seeing that anywhere in North America in terms of any jurisdiction in North America right now. We've got robust economy in many areas, many sectors, and we're still seeing, huge growth in homelessness and social services that are needed. And it requires government intervention, right? It requires policy intervention, and it requires resourcing to that extent as well. So when you look at it, we are the only city in Northern Ontario that's seen large population growth. As I said, we're close to 180,000 people, seen huge growth in the last couple of years. And what that's done is it's put huge pressure in terms of our housing stock and our housing situation, much like the rest of Canada. But it's compounded when you have aggressive growth and you haven't had, the growth in housing, et cetera, over the last couple of years. The other thing I'm sure you're familiar with is that from a community housing stock, we have not grown our community housing stock, nor has any jurisdiction, I don't think, in Canada in decades, right? So it's been under-resourced for a long time, and now we're playing catch up to try to meet the existing demand that was there, but also trying to meet future demand and the growing demand that's occurring within the community and within our community itself. So if you look at it from a social services perspective, we have, to put things into perspective, we have a caseload of about 2,800 people on Ontario Works. And then if you look at the Ontario Disability Support Program, which is run provincially in the province, in our jurisdiction, we're looking at a caseload of about 7,000 people. So you figure that's just under 10,000 people that require adequate housing at a low affordable rate on a monthly basis, right? So we know what the shelter rates are for Ontario Works. Your actual shelter rate is $390 a month if you're on Ontario Works. From an Ontario Disability Support Program, it's $556. And when you juxtapose that against, the market rent of $1,043, which is the CMHC metric, but certainly I would argue that it's much higher than that for a one bedroom and for even for bachelor units, within our community. It creates a huge problem, and it creates a lot of friction in the system. The other thing I would mention too is that our vacancy rate, the last metrics that we have on that goes back to October 2023, and we were at 0.7, right, for vacancy. And I would argue right now we're probably negative. Like when you look at all of our metrics in terms of time to housing, so someone comes into the homelessness service system and they're placed on the by name list, for example. We used to be able to house within 2 months. That's tripled, out to 7 months, for example, to try and find someone adequate housing. So all of those metrics have gone up over the last couple of years. And that's unfortunately where we find ourselves today is a growing number in regards to our by name list and our homelessness metrics.
And so people understand too, when you were talking about Northern Ontario, and this is why I came to visit you a year ago to see some of the great work you're doing. You're talking about how the city of Greater Sudbury acts as almost a funnel. So everyone from the north, there's no services north of Sudbury, or not many. And so you're not just servicing the 180,000, you're serving all of Northern Ontario, right? People will travel down. Toronto's way too far, but they end up in Sudbury. And so there's a bit of a push-pull. Well, these are not Sudburyans. Is that the right word? I don't know. These are not people from Sudbury. We should take care of our own, but all these other people are coming in, and it really doesn't matter. At the end of the day, they're in your city. You got to take care of them. Can you talk a little bit about that?
Yeah, so there's certainly further pressure within our system too. So if we look even at our caseloads for Ontario Works and Ontario Disability Support Program, on a per capita basis, they're higher than the rest of the province, than other large jurisdictions in the province. And then on top of that, you're quite right. So we have access programs, to social programs, social supports. And also we have a healthcare cluster here, right? So we have an academic teaching hospital, Health Sciences North, and the Northern Ontario School of Medicine. So people often come here for access to healthcare and access to programs and services, because you're right, we are the largest city in Northern Ontario, and we certainly have that critical mass in terms of being able to provide those supports. Of course, the other side to that, though, is that we need all of the infrastructure to be able to accommodate that, along with the population growth that we're seeing, right? And so that's what's creating some of the other friction within the system that you talk about.
Well, listen, I mean, we've outlined the challenges, and I got to say, when I came to visit you in 2023, and even since then, I think the city has stepped up. Yes, you're playing catch up, as you said, but you've done some really cool and innovative work. And in fact, I believe your council, you presented a plan to your city council to end homelessness, or it was a 2030 plan. So it was very, very ambitious. Can you tell me a little bit about some of the innovative work that you're doing right now?
Yeah, so if we go back to September 2023, City Council, basically asked staff, my team, to look at, Tyler, what would it take to really end homelessness in our community, right? And so what would it take to get us to that functional zero definition? And so we took some time internally, really studying, literature reviews and, looking at the resourcing. And as you know, you boil it right down to it, it's infrastructure, right? We need housing in place, and we need housing with supports. At the end of the day, it's quite simple when you boil it right down, but it takes a massive amount of infrastructure and investments from that perspective. So we came back to council in May of 2024, and we presented our report, which was unanimously approved by council. And it's interesting because my colleague Peter Sweeney in Waterloo, they were undergoing, I didn't even know at the time, but they were undergoing a similar exercise in the region of Waterloo, and they came out with similar numbers in regards, and we didn't even talk, right? So at the end of the day, we came out with similar sized budgets in order to solve this issue within our respective communities. And the numbers are staggering, but realistically, when you share it over all of government, it's really not that bad. And then you look at, what can nonprofits provide, and what can, private donors provide, which has happened in other jurisdictions in Ontario, where private donors have certainly stepped up. And we have a great giving community in Greater Sudbury. So when you look at the overall numbers, they were over $300 million. And a huge portion of that, though, as you know, would be capital, right? So we need to provide more rent geared income housing. We need to provide more low end market rent housing. And a lot of that has to be driven by the municipality at the end of the day. So really what we did is we outlined our report in 4 key pillars, and we really centered those pillars around the definition for functional zero, right? So making homelessness rare, making it brief, making it non-reoccurring. And from those 3 pillars, plus the 4th pillar, which is really about system level recommendations, that's how we grouped in, I think around 60 recommendations throughout those four pillars. So if I can take you through some of the pieces from that, the first piece is around making it rare. So really looking at, from an upstream perspective and from an inflow to the system perspective, what can we do on a prevention side? So we recognize that the current money that we have in place to prevent arrears, to help bail someone out in an arrears type situation on a 1-month period, for example, there's not adequate enough resourcing anymore, because the market rents have escalated so much that we need further budget to be able to assist from a rent bank type situation, right? So we need more investment in there. And we need to make sure that we're limiting as many people as possible from getting caught into that system on an inflow basis. Another piece to that recommendation is also working very much with our legal aid clinics. So we're seeing individuals that never would have touched the homelessness service system in the past, right? These are people that would have been housed for 10, 15 years stably. And all of a sudden they're touching the system for the first time, because there's an economic incentive within the community now to raise rents and to in some cases we're seeing sale of stable housing units that are now being reconverted into new multi-residential housing with high rents to them, right? So a partnership with our legal aid clinic to really look at making sure from people that don't touch our system in the first place. So you're not on Ontario Works, you're not in the Ontario Disability Support sphere, just sort of our low end individuals that unfortunately are just at the poverty line, and making it through every month, making sure that they have access to supports and services through our legal aid clinic, for example, to help with any types of situations where an eviction may be occurring. So that's sort of the first pillar, is to really look at how can we limit the number of people from an inflow perspective, and making it looking at the prevention piece. The second piece, of course, is making sure that it's non-reoccurring, right? And so the non-recurring part is huge. It's absolutely huge. And so those are investments in supportive housing, and those are big ticket money. That's big ticket items, right? So making sure that people have access to housing that has 18-hour, 24-hour supports in some cases, for individuals that have stabilized, come out of the homelessness system, have stabilized, and have somewhere to move on to. We're seeing situations, unfortunately, where people have fallen through the cracks. They've fallen through the cracks of the medical system or the correction system. And now they're in a situation where we can get them stabilized, but they can't live independently anymore, right? And so they may have an undiagnosed brain injury, or something like fetal alcohol syndrome, for example, where it was misdiagnosed. They've ended up, unfortunately, in the homelessness serving sector for many years. And, we've gotten them into a program, they've become stabilized, but unfortunately they need to move to, a long-term supportive housing type situation. And those are big investments. And it's not so much about the capital, it's about the operating, right? And that's an annual budget that needs to be replenished every year from the tax base to continue that program on a very long-term basis, right? So we have a call for two 40-unit long-term supportive housing type buildings over the life of this plan. And then the third piece is really access to housing. And like I said earlier, we need approximately 300 low-end market rent housing units today in Greater Sudbury. We need that today, and approximately 650 RGI units. So these are huge investments in terms of community housing infrastructure. And like I said earlier, they're investments that haven't been made in decades. So we are playing catch up, and we're trying to get ahead at the same time, right? Within a growing population context, which is part of the problem. And then the fourth pillar really is about system level supports, or system level recommendations. And the big thing here is that, we have great partnerships with our healthcare, with Health Sciences North, our local academic hospital, with police, with our mental health and addiction services. But the one thing we need to do is we need to get around a plan and advocate for a plan from the same song sheet, right? So that we're all on the same page, advocating for the same dollars for the same projects. And at the end of the day, you look at some of the work that's being done at UHN, United Health Network in Toronto, and they just recently opened, as I'm sure you're aware, a supportive housing facility. And that's, it's great to see a healthcare facility really stepping up and putting those units in place and bringing them on the market. And that really is a coordinated approach between the city, and I believe United Way is involved as well, and UHN, and to get that project off the ground, along with some private donors, as I mentioned earlier as well, to get that project going. And that's the type of collaboration we need, across all sectors to really drive some momentum.
It's an amazing plan. I love the pillars, and work is underway. I'm sure one of the challenges that as well your community faces, like many right now, and I know I think at AMO was a big conference, was a big talk of the town was around encampments. Can you talk a little bit about what encampments look like in the greater city of Sudbury, and what is it? How do you approach? What's your approach?
Yeah, so it's unfortunate because we were doing really well in the encampment sphere back in 2022, and so we had not seen in Greater Sudbury, encampments of any size. We knew that there were individuals that were living rough, prior to the pandemic. I'm speaking about. We knew that there were individuals, living rough, living in the bush, but certainly nothing close to what we're seeing, on the ground today, and nothing close to what we experienced back in 2022. So if we go back to, going into the winter of 2022, we had a large park that ended up being a large encampment site of about 50 plus individuals at the time. And city council came to us and said, we need to step up and provide some supports for these individuals and get them housed. And that was certainly the right approach, right? A housing focused approach to ending encampments is the way to go, and certainly that's great when you have housing available. And so I'll sort of take you through that sort of case study for you. But it also provides a glimpse, Michael, in regards to some of the archaic rules around housing in this province, and so in regards to community housing. And so I'll take you through that. So we have 50 people that are living in an encampment in a park, and we have 30 community housing two-bedroom community housing units that are in our community housing stock. But we can't put those 30 of those individuals into those units because they're two-bedroom units, and that would be overhousing an individual in Ontario, which is not allowed under the community housing rules, right? So what did we do? Well, we got innovative. We said, you know what? We're going to make a minor capital adjustment, and we're going to break down a wall. We're going to not break it down. We're going to take down a wall in between those two bedrooms so that it makes a large one bedroom, right? And so what we ended up doing is we ended up introducing some flex space within our community housing. So we can always put that wall back up if the demand changes over time, which is great. But it allowed us to get 30 individuals into housing that required one-bedroom units. So that was sort of a key linchpin in the plan. But also we introduced flex funds at the time. So flex funds were really, a pot of dollars from the municipality that dealt with things that other pots of funding from the province or municipally could deal with, right? So you had a situation where an individual, for lack of a better term, got caught in Greater Sudbury because they were traveling through and ended up in our homelessness serving system. But the person was from Edmonton and had supports in Edmonton. They had social services in Edmonton. They had access to housing. If we could verify that, we could provide some flex funding to be able to solve that person's homelessness in the moment. A very quick, rapid resolution, not a lot of approvals on it, just being able to deal with that. We had another situation where an individual kept locking himself out of his unit. He kept losing keys. So what did we do? We just used the flex fund to throw in, a new type of locking system so that he didn't have a key anymore, which is great. It worked out well in that. So that's the type of thing that flex funding did for us as well. And then the big ticket item, which I think we'll be talking about a little bit more, is the approval of really a transitional housing project with our local hospital, Health Sciences North, to put forward an assertive community treatment team at a small motel site, a pilot site, to deliver some clinical services to individuals as well and to get them housed. But we'll come back to that. The other pieces of that encampment plan at the time was bridge housing as well. So if we had, at that time, our shelters were full, obviously. But we had situations where people were still getting housing placements. And so if an individual, let's say, had a housing placement for November 1st, we could put them up in a motel, clear them out of the shelter system to create some throughput and some capacity until that November 1st date where they can move into their unit, and we could get more people into the shelter system. And then the other thing is we had to put more shelter beds in place. We had to put more overlay in place, and specific to low barrier women. So we had a mixed shelter at our mainline shelter, mixed gender. And so we saw a number of women presenting that needed low barrier access. And so we provided that. We started a new low barrier shelter for women. with some great community partnership with Elizabeth Fry, which was fantastic. So all of those pieces contributed to us reducing that encampment to, our encampment figures by January, February of 2023 had dropped to under 10, which was fantastic. We thought we were out of the woods, right? And unfortunately, you probably know where this story is going, but it has escalated since then. In 2022, 2023, we thought we were getting back to normal. We made it through the winter with the existing shelter capacity in place. We didn't require additional warming centers. We had people housed, right? And now, it's unfortunate because we're sitting here going into this winter looking at, a request for proposal that just closed to open more warming centers within Greater Sudbury. But it goes to show you, going back to my example about housing, if we have the access to housing, and then the supports that go with it, we absolutely can solve this problem, but it takes, a lot of resourcing, and it takes a commitment from all levels of government to move that forward.
And I believe that was the big push too, was to the province to give more resources to municipalities to work through, do some of the stuff that you're doing around encampments, which is wonderful, using housing and many forms of housing as a choice. And just so listeners are clear, when you said with the flex funds, that would be someone's choice if they wanted to go home, say to another part of the country, which is so cool and innovative. And listen, you touched on it, the innovation. Yeah. I want to hear more about this development of Lorraine Street, the partnership with Health Science North. How did it all come about? What are the objectives? When will it be built?
Yeah, so back in early days of the pandemic, we started to see sort of those encampment numbers growing. Our shelters were filling up, and City Council really tasked my team with saying, "Hey, what can we do to really get active about this problem, and how can we stop putting band-aids over it?" And so we came back with a big ask. Like, you look at our contacts from the municipal budget. This was an ask of, over $2 million a year. And there was a lot of puts and takes in regards to that particular budget year to get that funding passed. And, our budget chair at the time went to, leadership at our local hospital. They went to our police service, and, our budget chair sat down with them and said, "Is this what we need for the community?" And at the time, what we had said is that we want to put forward a variation of an assertive community treatment team, which is an evidence-based approach to working with homelessness in a residential setting, in a multi-residential setting. And our budget chair took that plan over and said, "Is this what we need? Is this what we need?" And unanimously, all of the leadership at those different institutions said, "Yes, this is what our community needs." And so came back to the budget table and really worked with council to move that through. And so what it is that you have we're developing a 40-unit multi-residential complex. And luckily, we were able to get some great partnership from the federal government in regards to the Rapid Housing Initiative through CMHC to provide some of the capital for that. And then we also matched that with some of our municipal funds as well to build out this 40-unit complex. And so it will be up and running by early 2025. It's been a few hiccups through the construction process, but we're well along our ways now. To get that up and running for 2025. And right now what we're doing, Michael, is we've got a small pilot site running at a local motel that we've been using probably a little bit too longer than what we wanted to, because it only holds 13 people. So it doesn't have a full staffing yet of an assertive community treatment team, obviously. But we're seeing some good results out of it. We're seeing a reduction in terms of number of admissions into our emerge department. And obviously you can imagine, a huge reduction in regards to accessing of other social services within the community with this team in place. So we're ramping up, we're moving forward, and we're hoping to have things open, like I said, in 2025. And it's a great partnership with our local hospital, Health Sciences North. And it's unfortunate because we haven't gotten the funding yet for it from the province. So we've been picking this up on the municipal tax levy up until now. But as you probably saw, there's been an announcement for hard hubs and for the province of Ontario, request for proposal, limited in nature in terms of the numbers that they're looking at approving. But I think this project fits it so well, and part of the component of that is really about supportive housing. And what this provides is a supportive housing environment from a transitional basis, though. And so it really looks at getting individuals stabilized within these 40 units, access to nursing, PSW, peer support, psychiatric and addictions medicine, allowing individuals to get stabilized, and then allowing them to move forward in the housing continuum. And so, as I mentioned, they'll have access to a large number of resources. We're hopeful. We're applying for the Hard Hub application, and we're hopeful that that will be funded from a provincial perspective, because it is a healthcare, a healthcare budget at the end of the day, which should be funded provincially. And we'll hear about that towards the end of the year. But either way, we're moving forward as a community, and I look forward to sharing more about that.
Once you get going, I mean, I think health and homelessness and treatment are so, I mean, they're always overlapping, right? So this is brilliant. And listen, if that doesn't meet the model of Hard Hub, I don't know, what does. I think it's brilliant. There's also municipalities at the end of the year can do business cases to the province, right? Where there's like a little bit of money. Each municipality pitches what they think. And I mean, it's a bit of a shot in the dark, but just saying, yeah.
Campbell, yeah. And we've done that in the past. Actually, we haven't been successful yet, but certainly we'll roll the dice.
This is your year. Listen, I think Minister Calandra is probably listening to this podcast. So just a plug for the greater city of Sudbury. This is where the Hard Hub and where those extra funds should go. This is a brilliant project.
Yeah, and you know what? We, to add to that, Michael, we recognize the province and federal government have all made significant announcements, over the last couple of years in regards to that, right? So there's some significant announcements that have been made in regards to housing, et cetera. But it's everyone's looking for it for sure.
Yeah, it's time. We've got to have action right now for sure. Let's talk about what do the next few years look like in the great. I mean, you have so much going on. This is going to open in early 2025. What are your hopes for the next few years?
Yeah, so just from a macro level, we've got a very engaged mayor and council. They're driving growth forward. Our mayor has an awesome vision to grow this population here in Greater Sudbury, to grow the community to 200,000 over the coming years. And certainly we are so well positioned in regards to the critical mineral strategy for the province and for the country, that we're going to see huge growth in Greater Sudbury over the coming years. Now, the key piece to that, and my colleagues in planning services and myself are gearing up with these types of plans, right? So our planning folks division is working through strategy as well on housing supply, right, on the market side of things, to really try to loosen up some of the market supply in regards to housing. And we're coming at it. We're working hand in hand with them in regards to this plan and the creation of more affordable and community housing within our community. So we've got some huge growth on the horizon, and we're looking forward to meeting the challenge and really working closely with our provincial and federal partners, as we have in the past, to move this plan forward and to get the investments moving in the right direction on a lot of these recommendations.
Well, listen, I mean, I'm not surprised the population is booming, right? You've got meaningful, well-paying employment. I mean, for anyone who's made the drive up to Sunday, it's just a gorgeous drive. It's a beautiful, beautiful place. And I believe you have like how many 32 lakes, or the number of lakes, and hundreds of lakes. Yeah, I mean, it's incredible.
Hundreds of lakes.
Everywhere you turn. Now, the one thing when I did go up there,
everywhere you
guys talked about the 4 seasons of bugs, which I think you leave that off the brochure when you're pitching, because it's certainly
that's right.
really wasn't all that appealing. But listen, you're doing incredible work. If people, I don't know if it's public, but if people want to find out about some of the projects you're working on, some of the work you're doing, or your plan to end homelessness, is there somewhere they could go? Can they follow you on social? Where can they find out more?
Yeah, absolutely. We've got all of our information, and the actual roadmap that we produced is listed on our City of Greater Sudbury website, so people can access it through there. The other thing is that the actual live stream from the council meeting that occurred was at the end of May 2024, and you can access that through our agendas reports on the City of Greater Sudbury website as well. So you can navigate through there and actually listen and look at the meeting that we had on that evening. I think you're past 2 hours in, so you're gonna have to fast forward a little bit in regards to that live stream. But we had a really good discussion in regards to homelessness that night. We were talking about it for over a half an hour in regards to some of the structural issues that our community is facing, but also what are some of the great innovative solutions that we're going to bring forward.
And I love the fact that your mayor is so supportive. I mean, it really does start there. I remember talking to former Mayor Vaughan, Mauricio Belabacqua, and he was a MP, and I said, it's the same, different, and he said, municipally, you can just pull more levers and get things done, and there's a real sense of satisfaction. He said federally, it's just a lot slower, provincially, a lot slower. So when you have a mayor, and it just shows when mayor and council give you, the means to do things, your team is just moving and shaking and doing the right things. It's incredible to have that kind of support, and we've seen this.
Yeah, certainly. Our mayor as well was a former member of parliament as well in Ottawa. So. Definitely knows
exactly. Well, listen, Tyler, thank you so much for all you're doing in the greater city of Sudbury and for all the north of Ontario. So innovative, so cool. There's so many gems to pull out of this podcast that can be duplicated and scaled elsewhere. So I hope people reach out and check out the plan. But thank you so much for taking the time to be with us today. All right, we'll see you next time on the way home.
Really appreciate it, Michael. Thanks.